Channel 5's Ryan Nelson took a closer look at how the healthcare industry is regulated in the state and who you can contact if you suspect abuse.
There are essentially two main agencies responsible for keeping an eye on those you trust around your loved ones in the state of Texas. The Department of Aging and Disability Services sets the standards on daily operations. Adult Protective Services will investigate their behavior at your insistence.
This is her restroom area.
Paul Vazaldua converted his garage into an apartment for his mother. He wants her far away from the home health care system.
Well, I think that there's very many capable home health providers and capable assisted living facilities. I just wanted to have one little more safeguard.
Not all families have the resources or time to follow suit. Some rely on the home health care industry to keep an eye on their loved ones. We wanted to take a closer look at who's keeping an eye on those who look after your loved ones. In the state of Texas, the Department of Aging and Disability Services, or DADS, is the regulatory body responsible. According to their website, DADS licenses, certifies, and surveys home and community support services agencies for compliance with state and federal laws and regulations. Through these regulatory activities, DADS protects Texas citizens receiving home health, hospice, and personal assistance services. DADS conducts surveys to ensure the compliance of these agencies. Stats obtained by Channel 5 News from DADS revealed there were 2,194 violations in the Rio Grande Valley alone from the start of 2016 through October 31st of this year. They're also the enforcement agency, meaning an array of enforcement actions are available under state licensing laws, including actions against an agency's license and monetary sanctions called administrative penalties. For HCSSAs with a Medicare provider agreement, recommended sanctions may include revocation of the Medicare provider number. If you suspect mistreatment of a loved one in the home health care system, Adult Protective Services will take a closer look at your concerns.
What we do at APS is we investigate abuse, neglect, and exploitation of individuals that are over 65, as well as adults 18 and over that have a substantial disability.
APS Community Engagement Specialist Gustavo Salinas says when it comes to keeping your loved one safe, no concern is too small.
We stress is that you don't need to know that abuse, neglect, or exploitation is going on, just that you suspect that something's not that something's not right.
Vazaldua hopes he'll never have to encounter issues of this sort. If you're concerned about a loved one in home health care, you can reach out to Adult Protective Services by calling 1-800-252-5400. In the studio, Ryan Nelson, Channel 5 News at 10:30.